Hey everyone, today is February 20th, and in just a few minutes I will be heading out to Pacific Clinics to check out their new wheelchair accessible trust van that I had the privilege of funding through an inventory grant in the last budget cycle. Trust stands for Trusted Response Urgent Support Team, and it is a pair of um, a pair of professionals. One is an EMT, one has experience in counseling and de-escalation. They respond to calls for people who are experiencing a mental health or substance use disorder crisis. Hopefully you already know about 988, which is a nationwide um, warm line for suicide crisis and information about mental health services and resources. In our county, when you call 988, there is also some triage that's done to determine whether you need somebody to come out to help with de-escalation of a crisis that cannot be resolved on the phone. So our county has 4 levels of response. Essentially the lowest acuity response is trust. This is, again, this pair of professionals. There's no law enforcement as part of the trust response. That was a particular piece that many community members advocated for. So when you call 988 or the 10-digit dedicated trust line, it will be answered in the Pacific Clinics call center or in one of our other call centers. They will go through a series of questions with the person on the phone, make a determination whether a trust van needs to be deployed, and then make that call to send the van out to assist that person in crisis. So I hope you will stay with the video. Join me to see the trust van in action.
A good portion of all of them because we wanted to make sure that it's at least getting.
We are aware the teams are, they have a CIS, crisis intervention specialist, and a first aid responder. So I'm one of the first aid responder supervisors. So
my name is Devin Polchek. I am the first aid responder supervisor here at Trust. My role is supervising the first aid responders at Trust who hold EMT licenses who go out and serve the community. So day to day, what we do is we support our staff. We go out in the community and provide resources, crisis stabilization, any type of support with anybody that's having any substance use difficulties. And we pretty much go out there, provide support, resources, and build a relationship with them so they know they can call us back at any time.
This has been a really powerful morning. I definitely thought I knew a lot about trust and could talk about it knowledgeably, but I learned a really good deal this morning. One of the most significant learnings actually is that trust not only responds to crisis in the moment, but when they are not out on calls, they actually do proactive work in our encampments or places where unhoused neighbors are located. They'll go and offer resources, snacks, make sure people know about the service, know that there's an opportunity for help. And another piece that I learned is that when they're engaging, when the trust folks are engaging with community members, they can provide not only crisis support, but they can connect residents to a range of other services that are of particular use to our unhoused community members. So that was a cool thing to learn. I also learned that trust does not, for the most part, initiate 5150 holds. That's a hold that would put somebody into a secure environment for their own protection for 72 hours. The trust responders are going out to de-escalate. Most of the time they are successful in doing that. When they feel that there is a higher level of need and that a hold may need to be initiated, they will call one of the 3 higher levels of response that our county has, and they will of course stay with that person until that next level of support arrives. that was impressive to me too, and it helped me better understand the interworking of the 4 different mobile crisis response units that exist in our county. Overall, I was just impressed by the compassion and empathy and competence of everyone, from the people that answered the phones in the call center to the folks that drive the van and also respond to the crisis, to the other support staff at Pacific Clinics that helps to make sure that this service is well integrated, that it's responsive to community feedback. There's been lots of iteration since Trust has rolled back, and I was glad to hear that they present their data every month to a community advisory committee so that we all can know how many calls they're answering, how many calls need a field response. Of those field responses, how many are successfully de-escalated and how many need to be elevated to another level of care. All in all, it just further reinforced my strong belief that Trust is an incredibly valued service. To operate at the same scale as 911, we would certainly need more than the, I think, 7 vans that are in operation now. And I would welcome all 15 of our cities who are interested in helping to expand Trust response in their areas to reach out to the county and talk about how we can partner with you so that we can expand Trust access and make sure we are there for every person who experiences a mental health crisis.